Hello, everyone, and welcome to our monthly Introduction to Minnesota Paid Leave webinar. My name is Gabriella, and I'm part of the engagement team for Minnesota Paid Leave, and I'll be facilitating today's webinar. We're so thrilled that so many of you can join us today. We have about 495 people online with us today and counting. Thanks for joining us all. At today's presentation, we'll explain what Minnesota Paid Leave is and how it impacts both employers and employees. We'll talk about who's eligible for paid leave, the two main types of leave, medical and family, what responsibilities employers have, and much more. We also have a lot of information on our website, info.paidleave.mn.gov, including frequently asked question pages for both employers and employees. And we'll be posting even more information on our website in the coming weeks. I'll also note that today's slides are already on our website as well. You can find them on our public events page. The webinar will be recorded for training purposes. Should we decide at a later date to make the recording public, a link will be posted to our website and all registrants will be notified. Additionally, we send out regular email updates about paid leave, which most of you signed up for when you've registered for this webinar. But if you didn't, or if you're not sure if you did, you can always sign up for our newsletter on our website. By the way, my team member is putting all these links I just mentioned in the chat. All right, so today we're joined by Betsy Orn, Paid Leave Strategic Program Analysis Manager. We'll start with a presentation from Betsy, followed by a question and answer session. For the Q&A session, you can submit your questions to us using the chat button. You can find the chat button at the top of your screen. It's a purple speech bubble with a question mark in it. There are two tabs in the chat, the Feature tab and a My Questions tab. Check the Feature tab to see any announcements from our team and the links we mentioned throughout the presentation. Use the My Questions tab to ask a question anytime during the presentation. Only you and the Paid Leave webinar team can see your questions. Other attendees cannot see them. Our team behind the scenes will be reviewing and moderating the questions for the Q&A session. Of course, with the number of folks online today, we're looking at 692 attendees now. We're not going to be able to answer every question you may have, but please ask them anyway. We keep track of all the questions and we use them to inform our outreach and update our FAQs on our website. And if we don't get to your question today, our contact center is ready to help you at any time. Just reach out to them through the form on our website. Again, that's info.paidleave.mn.gov. All right, that's enough from me. Now it's time for our presentation. So I'll pass it over to our presenter, Betsy. Take it away, Betsy.
Thanks, Gabriella, and hi, everyone. I'm Betsy, and it's so nice to be with you all today and to talk about Minnesota Paid Leave. Before we start jumping into details about the program, I want to just say a few words about why paid leave matters. As a lifelong Minnesotan, one thing I love so much about this state is that Minnesota is a place where people take care of one another. Whether it's helping your neighbor dig out during a snowstorm or bringing them meals when they're sick, Minnesotans really step up and take care of each other. Minnesota Paid Leave will support people during those big moments in their life when they need time to care for themselves or their loved ones. People will turn to paid leave during some of the biggest moments in their life. They could be really happy moments like the birth of a child, or more challenging ones like dealing with a serious medical condition. We've been spending the last year talking with employers across the state, and we know that employers really care about their employees and they want to support them during these big moments. And Minnesota Paid Leave will help them to do that. Paid leave also has a lot of benefits for employers. It can improve employee retention, morale, and performance. The bottom line is that Minnesota paid leave will help ensure employers can support their employees and that employees don't have to choose between financial stability and being there for their families during these big moments of their life. So what is Minnesota paid leave? Well, let's start with some basics. Paid leave is paid family and medical coverage for Minnesota workers. The Minnesota paid leave passed in 2023 and it was updated in 2024. It goes into effect January 1st, 2026. The law provides job protections and partial wage replacements to individuals who take leave for a qualifying condition, such as to bond with a new child or for medical care for themselves or for their loved ones. And the program will be funded by premiums made up of contributions from employees and employers. The premiums will go to the state and the state will send benefit payments to the employee while they're out on leave. Just as a side note, this is one difference between paid leave and earned sick and safe time. So unlike sick and safe time, paid leave payments will come directly from the state, not from employers. It's also worth noting that there's a reduced premium for small businesses, so it'll be less expensive for them to participate in the program. This is paid leave on a slide. The program is split into two major buckets. There's medical leave and family leave. Medical leave is exactly what it sounds like. It's time to care for oneself in the event of a serious healthcare diagnosis or condition. And these are conditions that last at least 7 days. To be approved for medical leave, an employee must have certification from a healthcare provider that the leave is necessary. Again, you might be thinking, is this similar to earned sick and safe time? A key difference is that ESST is used for shorter term or day-to-day absences, while paid leave is really about those long-term absences lasting at least 7 days. So that's medical leave. Family leave is a little bit broader, and there are 4 types. Bonding leave is for welcoming a child to your home through birth, adoption, or foster care. Active duty leave is when you need to support a family member who is on active duty or who has been notified of an impending call to duty. Caring leave is leave to care for a loved one with their own serious healthcare condition. And safety leave is leave to support survivors of domestic abuse, sexual assault, or stalking for reasons such as attending court appointments, seeking medical care, or finding safe housing. The program offers up to 12 weeks or 3 months of medical leave or up to 12 weeks of family leave in a single benefit year. And a benefit year starts on the first day of absence. So day 1 of someone's leave is day 1 of their benefit year. If you need both kinds of leave in a benefit year, you could qualify for up to 20 weeks combined. This could look like 12 weeks of medical leave and 8 weeks of bonding leave, but not 12 weeks of both. Again, certification is required in different forms for each of these types of leave. In terms of coverage, the program is very broad. It covers nearly every employer, regardless of business size, revenue, or number of employees. It also covers nearly every employee, including full-time, part-time, temporary, and most seasonal workers. This slide calls attention to specific groups that we get a lot of questions about. So the green box shows employees that are covered by paid leave. There are a number of industries listed here that are not included in the unemployment insurance program, but they are covered by paid leave. These include agriculture, religious organizations, and businesses with employed family members. So if you've been wondering about one of the groups listed in the green box, they are covered by paid leave. The purple box shows employees who are not covered by paid leave, but who can opt in. Those are independent contractors, self-employed individuals, and tribal nations. They are not covered, but they can opt in, and we will have more information about that process in the coming months. The orange box shows employees who are not covered by paid leave and cannot opt in. Because this is a state program, it only covers Minnesota employees. And the law defines a Minnesota employee through a localization test. That test has two parts. First, an employee must physically perform work 50% or more of the time from a location in Minnesota. If they do work 50% or more of their time from a location in Minnesota, that means their work is localized in Minnesota and they are covered. So anyone who spends a majority of their time seated in an office or working from a physical location in Minnesota, they are covered. Second, employees who do not work 50% or more of their time in any one state, then it comes down to whether they live in Minnesota. So for example, say someone works a third of their time in Wisconsin, a third of their time in Minnesota, and a third of their time in Hawaii. Wouldn't that be nice? Well, then their work is not localized in any one state. Then if they live in Minnesota, they are covered under paid leave. If they don't, they are not covered. So the folks not listed here are those who perform 50% or more of their work in another state. They are not covered. I know this is a bit confusing, so let's talk through some scenarios. Scenario one, I have employees who work mostly in Wisconsin. Are they covered? Remember, it matters where that work is physically performed. And if they performed 50% or more of their work in Wisconsin, the employee is not covered. So even if the employer is based in Minnesota, if the employee works from home in Wisconsin remotely, they are not covered. Scenario two, my business is in North Dakota, but some of the people I hire live in Minnesota. Are they covered? So again, the test relies on where the work is physically happening. So if they work in North Dakota 50% or more of the time, they're not covered. But if those people work in Minnesota 50% or more of the time, maybe as remote employees, they would be covered under the program. Okay, last scenario. I'm a traveling salesperson and I do work across the entire Midwest. Am I covered? So in this case, again, it depends on whether you spend at least 50% of your time working in any one state. If you do spend 50% or more of your time working in Minnesota, you're covered. If you spend 50% or more of your time working in Wisconsin, you're not covered. And if you don't spend 50% of your time in any one state because you're traveling equally across many states, you have to be in Minnesota to be covered by the Minnesota paid leave law. So for all these situations, employers should determine coverage based on this test and then submit all of the wages for covered employees in the way that we'll talk about in future slides. All right, so I mentioned that the program has two main parts, partial wage replacements and job protections. So let's talk about how each works, starting with partial wage replacements. Partial wage replacements allow people to get financial help while they're on leave. And those payments will depend on a person's income. The lower the income, the higher percentage of wages are replaced, up to 90%. At higher income levels, a lower percentage of wages are replaced, down to 55%. The maximum benefit amount is capped at the statewide average, which is $1,372 per week in 2024. So that's the most someone could get in a benefit payment, a weekly benefit payment. And that average wage will be set every year. The only requirement to qualify for partial wage replacements is that you must have earned at least 5.3% of the statewide average annual wage in the past year. So that will mean that if in the past year you earned at least that amount, and currently that's $3,781. If you earned at least that amount in the past year, you would qualify for wage benefits under the program. So it's a fairly low barrier to qualify for partial wage replacements. So in addition to partial wage replacements, paid leave offers job protections. And these work a little differently. Job protection means that if an employee takes leave under the program, they'll need to be restored to the same position or an equivalent position with the same pay, benefits, length of service, and seniority as they had prior to taking leave. And job protections kick in 90 days following the date of employment. which is different than wage replacement. So to recap, for partial wage replacements, there's an earnings threshold. And for job protections, there's a tenure requirement of about 90 days of employment. So that's a quick overview of the program. For the rest of the presentation, I want to touch on what it means to be an employer when paid leave goes live and how you can prepare today. So this slide shows some key dates for employers to be aware of. In July, the equivalent plan application will open for employers. Employers will be able to apply for an employer exemption to offer a plan that is at least as generous as the state program. You can find more information about this on our website. By December 1st, 2025, employers need to notify their employees about paid leave benefits. And then in 2026, a lot happens. The program will go live on January 1st, and that's when people can begin taking leave. Payroll deductions can also start on the same day. The first quarterly premiums are due by April 30th, 2026. Small business assistance will also become available in early 2026. We're going to go into more detail about these milestones in the next slides. So what do employers have to do to get ready for paid leave? We like to think of employers' role in 4 different buckets. So starting in the top left, there is reporting wages and submitting premiums to fund the program. There's educating and informing their employees about the program, supporting leave administration and coordination of benefits while somebody is out on leave, and then working with us to collaborate and improve the program over time. So first, in terms of reporting wages, to determine if someone is eligible for paid leave payments, Minnesota employers need to report wage data for their employees. The paid leave program is using the same online reporting system as the unemployment insurance program to reduce administrative burden for employers. Wages will be reported once per quarter using the current UI wage detail reporting process and format. As of February 1st, employers have reported wages for more than 3.4 million employee records through that UI online portal, which is outstanding. And that means that for most employers in Minnesota, they have already done the first step to get ready for paid leave. If you are an employer and you're only now discovering this is a responsibility, don't panic. The UI Customer Service Center is available to help get you set up and make sure you have the account that you need and are reporting wages in the correct way. The information for the contact center is on the screen right now, including the phone number that is open 5 days a week. Starting in January 2026, the paid leave program will be funded much like healthcare premiums. Those will be split between employee and employer contributions. The combined premium rate will be 0.88%, which is the fourth lowest of state paid leave programs in terms of cost to employers and employees. The premium rate will be applied only to wages up to the Social Security cap, or $176,100. So for an employee making more than that in a year, premiums will not be collected on earnings above that amount. And just like the program is split into 2 major buckets, premiums are also split between medical leave and family leave, and each makes up a portion of the total premium. The medical leave portion is higher because that is the most common use of paid leave. So the family premium and the medical premium is again split into an employer portion and an employee portion. Starting on January 1st, employers will be able to deduct up to 50% of the premiums from employee paychecks. So basically that means when it comes to splitting premiums, the rule is employers cover 50% or more and employees cover 50% or less. employers may choose to pay more than their required portion for some or all of their employees. For small employers, their portion of the premium is reduced by 50%. So small employers are defined as employers with 30 or fewer employees and an average employee wage of less than 150% of the statewide average, which is currently 150% is currently $107,016. The reduced employer premium does not change the amount owed by employees. Okay, that's a lot of math, but don't worry. We've created an online calculator that will do all this math for you. So employers can enter information about the number of employees and their wages and get an estimate of how much they and their employees will pay. Likewise, employees can also use the calculator to get an estimate of how much will be taken out of their paycheck for the premium. My colleagues are putting that link in the chat, so feel free to go to that site and look after this webinar to learn more about premiums and what you can expect. Another way that paid leave is working to support small employers is through a small employer assistance program, which is funding that's earmarked for small businesses. So on January 1st, we'll launch a small business assistant grant program to help employers offset the cost of hiring a temporary worker or paying an existing worker to cover for an employee who's out on leave. Employers who meet that definition of small employer that we talked about on the previous slide can receive up to $3,000 per absence or up to $6,000 per year. Next, we'll talk about coordinating benefits and leave while someone is out. We recognize that paid leave doesn't exist on its own. We're going to be providing more information, more guidance on how these benefits coordinate with one another, but we wanted to share a few key ideas today. The program allows employers to designate certain benefits as supplemental benefits, and those can be used to make up the difference between partial and full wage replacement. So for example, an employee can allow PTO to be used throughout leave to help top off an employee's wage. So what that might look like. Say an employee is receiving 2/3 of their wages while they're on leave through benefit payments from the state. An employer could choose to pay 1/3 of a day of PTO to make up that employee's pay and raise it to full wages during their leave. An employer has the choice to offer that benefit, and the employee has the choice to accept it. Other payments received that are not supplemental benefits are generally considered offsets. Those are payments that would reduce an applicant's benefit payment. For example, if an employee chooses to take a full sick day in the middle of their leave instead of paid leave benefits, their benefit amount would be offset by that payment. Finally, there are payments that, if received during an absence, make someone ineligible for paid leave benefits, such as receiving unemployment insurance or workers' compensation payments. All right. Like I mentioned before, one key role for employers is telling their employees about paid leave. It's important for employees to know about the program at least 30 days before they start paying into it or before they can start taking leave. That means employers must begin notifying their employees about the availability of paid leave on or before December 1st, 2025. And there are 2 notification requirements for employers. The first is to hang a workforce poster in English in any language spoken by 5 or more employees. This is really similar to other wage and hour program requirements, such as workers' compensation and earned sick and safe time. Prior to that date, DEED will create this poster for employers to use, translate it into a variety of languages, and put it on the paid leave website for download. The second major notification requirement for December 1st, 2025, is for employers to notify each employee individually about the availability of benefits in their native language. To support employers in this, the state will create a model notification letter in multiple languages and put that on our website as well. This is a great reason to sign up for our newsletter so you know about these as soon as they're available. Finally, there are a lot of different ways to stay in touch with us, and we're dedicated to making sure employers and the public have the most up-to-date information possible. One way to keep in touch with us is to watch our website, paidleave.mn.gov. We have frequently asked questions and a toolkit of resources for employers. We also encourage you to sign up for our monthly newsletter for key updates on implementation, answers to questions we're hearing, and new information as it becomes available. Lastly, we have a contact center ready to help you at any time. Just submit your questions on our website and our team will get back to you. We wanted to share one last exciting update about the paid leave program. The paid leave law created a grant program that allows community-based organizations to support with outreach, education, and technical assistance about the paid leave program. The goal of these grants are to increase equitable awareness, understanding, and access to paid leave. Through targeted plans to support employees, employers, and self-employed individuals, these grants will help amplify the work of our engagement and communications team. Here are a few key dates about the public outreach grants. The RFP was posted on our website on April 1st, and we'll be accepting questions through May 15th at the email listed there. We will be updating an FAQ with answers to those questions throughout, and applications are due by May 30th. Selected grantees will be announced July 18th, 2025. So for more information, visit our website to learn more. All right, well, that's it for my formal presentation. We're going to use the rest of the time to answer some questions.
Awesome. Thank you so much, Betsy. Now we're going to transition over to our Q&A session. But right before that, I want to remind you all that, again, today's slides are available on our website right now, info.paidleave.mn.gov. All right. Thanks so much to everyone who submitted a question. If you'd like to still submit a question, please do so. Again, you can find that chat button at the top of the screen. It looks like a purple speech bubble with a question mark in it. A reminder that only you and our webinar team can see your question. And like I said, all of your questions are important to us, and we'll address as many as we can today, but there are quite a lot of them. So, like I mentioned before, if we aren't able to get to your question, please know that our contact center is ready to find you. And apologies, it seems like our automated lights went off. Give me 1 second. And we're back. Yes, our contact center is ready to help you via our online form. And again, those links are put in the chat by our staff member. All right, so I'll start off with a few common questions that we often get, because a lot of our folks on the call are likely to have the same questions about the topics. Then we'll get to questions from our audience. So, Betsy, the first one, if an individual has a baby in late 2025 before paid leave goes into effect in 2026, are they still eligible to apply once the program goes live?
Great question. So a person is eligible to take bonding leave within 12 months of welcoming a new child into their home through birth, adoption, or foster care. So for someone giving birth in October 25, that means that they would be eligible to take leave with their child in 2026, as long as that leave is complete by their child's first birthday. And each parent is eligible for up to 12 weeks of bonding leave.
Awesome. So up to a child's first birthday.
Yeah.
Okay, next question. Can employers opt out or choose not to participate in paid leave? And what about individual employees? Can they opt out?
So employers cannot opt out of the paid leave program, but they can choose to offer an equivalent plan instead of participating in the state program. So they can apply for an equivalent plan exemption for a plan that meets or exceeds the coverage offered by the state. Employers that are approved for an equivalent plan will not pay premiums to the state, but they still have other obligations under the paid leave law. They must still submit wage detail reports to the state each quarter and comply with requirements to notify their employees about coverage. So again, there's not an opt-out process for employers and employees, but there is a way to meet the requirements under an equivalent plan.
Awesome. Thank you so much. Next question. Will an employer's premium rate increase if employees use paid leave?
Yeah, Gabriella, we get this question a lot because our program is connected to unemployment insurance and how we report wages. But unlike unemployment insurance, rates are not tied to whether an employee uses the program. That 0.88% premium is consistent for the program. It doesn't matter how many of your employees take leave.
Got it. And how will paid leave work with paid time off or PTO and sick time or vacation time?
Yeah, so I talked about this a bit, but just to reiterate, so employees can choose to take sick, vacation, or paid time off in lieu of leave, so instead of leave. If they choose to do that, their benefit amount will be prorated or reduced for the time that they take PTO, sick, or vacation. But as I mentioned, employers may also designate specific time like PTO or vacation or sick as a supplemental benefit, in which case that time can be used to supplement or top off the benefit payment while they're on leave. So that's an important consideration that employers should be thinking through now. And it's a question employees might want to ask their employer, are they planning to do that?
Great, thank you so much. I know that coordination of benefits is something that we've gotten a lot of questions around here in this webinar today. Additionally, do employees have to notify their employer about their intention to take leave?
Yeah, so employees are required to notify their employers up to 30 days before their leave or as soon as is practicable, so as soon as they can, in the event the leave is unplanned. So when employees apply for paid leave, they will be asked if they've notified their employers, and they'll be required to attest to the date and the method they use to notify their employer. And that will be also sent to the employer to review.
Got it. So employees do have to notify their employers about their intention to take leave.
That's the first step that employees should take, yeah.
Awesome. Okay, and what counts as a benefit year? Is it a calendar year? Is it a fiscal year? What does paid leave qualify as a benefit year?
Yeah, so under our law, a benefit year starts the day someone first takes leave under the statute. That means that's the day that their wage replacement rate will be calculated for the whole year. It's also when their leave allotment begins and when they can begin taking up to 12 weeks within 1 year from that date.
Amazing. And this question was asked a few times as well. Are S Corp owners covered by paid leave?
Great question. We've been getting this a lot. So there is no explicit exclusion for S Corp owners or operators under the paid leave law. So that means that an S Corp's wage-taking shareholders and any of their employees are all considered employees of an S Corp. So the S Corp should set up a paid leave only account on the UI website and report the wages of any employees and of their shareholders' reasonable wages from their W-2s.
Awesome. Thank you, Betsy, for answering those common questions. Now let's transition over to the questions from today's audience. And again, thanks so much to everyone who has submitted a question so far. And if you'd like to submit a question, please do so. Again, you can find that chat button at the top of your screen. Okay, so the first one, how do employees request paid leave? Is it through the state website or through the employer?
Yeah, great question. So the process will be through our state website. So our state website will have the application, and people will go onto our website and fill out the application. Employers will get notifications and have an account where they will be able to see those applications and any notifications they need to know about those leaves.
Awesome. And the next one is about continuous versus intermittent leave. Would it work for employees to reduce work hours due to taking care of a family member, or does it have to be a full leave from work?
Yeah, great question. So one thing we didn't get into in the presentation is that leave can be either continuous or intermittent for all leave types. And so that means that a continuous leave is taken all in one chunk, and intermittent leave is taken in smaller chunks. And those chunks can be, the employer has the discretion to set sort of what is the minimum increment of those chunks. So for example, an employer could say you could take leave off in full days or in hours. And in that case, an employee would apply and let us know, let their employer know, and the state know what the proposed leave schedule is, when they're planning to take off time. And they would need to have a certification to sort of say this amount of time is medically necessary or necessary for this reason based on leave type. So yeah, someone who's taking care of a family member could definitely take a reduced schedule and take consistent days off or periodic days off as needed to care for that individual. In that case, the medical provider of the person needing leave would have to fill out a certification explaining that that is medically necessary.
Awesome. Yep. Continuous versus intermittent leave, a lot there. Thanks so much, Betsy. Similarly, in terms of coverage, if an employee has more than one qualifying event in a year, how much time would they qualify for in paid leave?
Yeah, great question. So again, the total leave bank for a year is up to 12 weeks of family or 12 weeks of medical or 20 weeks combined. So let's talk this through. Say I took off 5 weeks for a medical reason, and then I go away, and months later in the same benefit year, I come back and now need to take off leave for another medical reason. Well, 12 minus 5 is 7. I have 7 remaining weeks of medical leave. But if after that first absence of 5 weeks, I come back and I actually need to take family leave, I would have 12 weeks remaining. So the maximum is 20 total or 12 weeks of each. I will say in most cases, people do not take the maximum. What we've heard from other places is that it's very common for people to take less time, right? For a surgery or for a medical reason, people don't often need that much time, but whatever is medically necessary is what they'll fill out and apply for.
Awesome. Thanks so much. These next few questions are about localization. So if someone does work from home remotely for a company based in another state, do they qualify for paid leave?
So again, if their work is performed in Minnesota, so in the case where you're a remote worker and you are working from a seat in Minnesota, even if my employer is in New York or California, if I'm sitting in a seat at my home in Minnesota more than 50% of the time, then I do qualify.
Wonderful. And similarly, what if a company has an employee that lives in Wisconsin? So the company has an employee that lives in a different state, but works 100% in Minnesota. Do they qualify for leave?
Yeah, so again, think of where are you sitting when you're doing the work or where are you standing? If they are working in Minnesota more than 50% of the time, 50% or more of the time, they qualify. It doesn't matter if they're a resident of Wisconsin. They would be covered under the program.
Awesome. And then we have a question about coordination of benefits here as well. So if a company already provides short-term disability payments for their employees, can employees get both short-term disability and paid leave? And who would be the first payer?
Yeah, great question. So we get a lot of questions about short-term disability. So one thing I should just state is that in places where they've implemented similar paid leave programs, we often see that the marketplace for these insurance plans changes. So typically these short-term insurance plans will start offering either equivalent plan options that meet or exceed the state coverage, or they start offering supplemental short-term disability programs that will make up that difference between what the state replaces the wage at and the employee's typical salary. But in that case that you continue to carry a short-term disability policy, paid leave is the first payer and short-term disability is the second payer. So for example, if paid leave pays 66% of someone's wages, replaces their wages, the short-term disability could then pay up to 33%, similar to other supplemental benefits.
Awesome. Thanks so much, Betsy. This question is about employer roles and responsibilities. So someone asked, what if you haven't created a paid leave only account and haven't submitted wage detail reports yet?
Don't stress. Right now, we just are working on getting the news out to everyone and trying to help people get in compliance. So if you are just learning about this today, there's no penalty right now or anything that we're trying to do. We just want to do everything we can to help you. So if you have questions, the UI contact center are really the best people. You can reach out to our contact center too, but UI is where the wage detail accounts are. So you can call them. Again, they are available. And maybe someone can find that phone number and bring it back up on in the chat so that people see that. But the UI contact center can help walk you through that process. They're extremely fast and responsive in terms of helping you set up that paid leave only account. And then you would just begin to report wages so that we have that information when the program starts. And we're really excited that you're learning about this program, and thanks for doing that and taking that first step to be part of the program.
Awesome. The next question is about small businesses. How is a small employer defined? Is it 30 or fewer, or in Minnesota, or 30 or fewer nationwide?
Great question. So for the small employer premium rate, it is about wages that are reported under the UI system. So it's about having 30 or fewer employees that meet that localization test in Minnesota. So 30 or fewer employees in Minnesota at any time in the previous year. The caveat I will say for that is that as we are considering and developing a grant program, we are exploring adding other criteria that would ensure that you also have a national workforce that is fewer than 30 employees.
Great, thanks so much. The next one is about equivalent plans. Could you speak a little bit more on equivalent plans and what that means for an employer?
Definitely. So I'll just share a few things that we know right now. And again, we are working to get a lot more guidance about this on our website so people are ready for that July date. There are really two kinds of equivalent plans. There is a private plan that an employer would purchase from an approved private plan provider. And in those cases, those plans are being reviewed by the Department of Commerce to make sure that they meet the criteria. And again, the criteria are really that the plan must be equal or more generous than the state plan. So that means things like it must have at least the same number of weeks of benefits, at least for the same qualifying conditions, at least pay the same amount or more to employees in those situations. It must offer job protections that are equal or greater than what our statute provides. So the Commerce Department is currently reviewing those plans, those private plans from the providers, so from the insurance companies, and they are creating a marketplace. And there are already a few. You can go to the Department of Commerce website and learn a bit more about what that looks like if you're interested in what plans are now available. As that marketplace grows and there are more approved plans, an employer can go out and buy one of those plans through an insurance agent like you would a short-term disability policy. And then you will go to our website and apply for an equivalent plan exemption. And it'll be a pretty straightforward process that will ask you, who are you? How many employees do you have? Which approved plan are you selecting? That process, that approval will go through and be approved, be reviewed by our team here at Paid Leave to make sure that it, again, meets all of the requirements, and then you would have an equivalent plan exemption. For those employers, they then will no longer pay premiums to the state. They would be paying the private plan or the private insurer for that program instead. But again, there are still some requirements under our law. They would still need to submit those wage detail reports, and they'd still need to make sure that they're notifying their employees in an appropriate manner. So those are some of the things that are laid out in statute. So that's a little bit about that kind of plan. There's also a self-insured plan. And in a self-insured system, basically the employer is planning to offer the insurance or offer the program themselves. So they'll fund it themselves. And in that case, they will go and apply to our website, make sure that their plan, again, meets those requirements of being equal or greater, equal or more generous to the state plan. And the one other requirement is they'll need to have a surety bond, which is really a financial backing that to issue that to make sure that that will back them up in the case that they need to provide that leave and to provide some financial backing to themselves and the state for that plan. So they'll submit both of those documents, their plan and their surety bond. They'll be reviewed and approved. So that's a lot of details. And again, we'll be having a lot more information as we go, but hopefully that was a helpful overview of equivalent plan exemptions.
Yes, a lot to know there in terms of
one more thing to note, Gabriella. I do want to encourage employers. We're going to have more information on this, but our plan is a really good deal. So I do want people to see 0.88 is a very good deal. So make sure that you are looking at that and understanding the costs of what the program and what the plan would be to yourself and your employers before you make that decision. We know it's a big decision for employers.
Awesome. Thanks for adding that in, Betsy. Really important there. This question is about ESST, or Earned Sick and Safe Time. Does paid leave run concurrently with ESST, or does it replace ESST?
Yeah, so there's no provision under statute for ESST to run concurrently with paid leave. But as we said, if someone is taking a day off during their leave for vacation, sick, ESST time, that would be prorated, or their benefit would be reduced for that time that they take if it's during their leave.
Great, thanks so much. Someone asked in the chat as well, can a husband and wife taking bonding time for a baby at the same time while working for the same employer?
Yeah, so we get this question a lot because there's a rule under FMLA about this. That rule does not exist under paid leave. So there's currently no requirement that they cannot do this. So an employer would want to communicate with their employees, but employees are both eligible for bonding leave under the state statute for up to 12 weeks. And there's no provision that they cannot take it at the same time.
Awesome. Thanks so much, Betsy. What about individuals who are adopting and fostering a child in 2025? Are they eligible for bonding leave in 2026?
Yeah, great question. So for adoption and foster care, it's really about the date of placement or the date of adoption. So as long as it's been 1 year from that first date of when they would, have paperwork that says it's the date of placement or this is the date of adoption, within 1 calendar year from that date, they would have the opportunity to take bonding leave for that child.
Awesome. Thanks so much. And then someone asked, how do deductions work with minimum wage?
Yeah, that's a really important question. So our law requires that premiums may not bring someone's wage below a threshold set in law, such as the minimum wage. So in the case that you have a minimum wage worker and they are, the premium cannot bring their wage below that. So either the employer has to make up that difference or the wage needs to be raised in order to address that situation. If you go on our premium calculator, you can do some math to help figure out what that looks like. Again, for a minimum wage worker, the premium amount is pretty low, but we know that's a consideration employers need to take into account and consider. So we encourage you to use that calculator to help you do that math.
Awesome. And the next question here is about certification. So will the state or the employer be responsible for gathering a medical certification to validate the employee's leave request?
So the certification requirement is really a requirement that the applicant must submit to the state. So the applicant or the employee must gather and submit, upload perhaps, that certification. And it could be from a medical provider in the case of medical leave, or there's a few other things like in the case of active duty leave, any orders that say this person is going on active duty would be sufficient. So it does depend on leave type, what that certification means, but it's really on the applicant to provide that certification.
Great, thanks so much. Someone again asked about bonding leave. Could bonding leave be taken intermittently?
Yes, bonding leave can be taken intermittently. And again, we're encouraging everyone, and part of the requirements is to be sharing those leave schedules with employers proactively. But that's something that has worked and will work for many, many different folks, is to take that leave intermittently.
Awesome, thanks so much. Someone else asked, when will the state website be live for employees to use or to submit requests for paid leave?
Great question. So we're busy working on that application process right now. We are hoping that we'll be able to launch it slightly before January 1st, if possible, for some employees to be able to put that information in. But because leave is not available until January 1st, 2026, that's really the date that the program will go live for most applicants. So there might be some specific soft launches before that for specific cases, but the application will for sure be live by January 1st.
Awesome. Thanks so much. And we'll take a couple more here. I know we're close to time. Does mental health or does paid leave cover mental health?
Great question. So under our statute, again, it really depends on if a medical provider is saying that someone cannot work for 7 days or greater for a health care reason, that could include mental health reasons, then yes, they would qualify. So as long as it is meeting that requirement that the mental health condition is so serious that someone cannot work for 7 or more days, that yes. And just an important sort of connected point is that means that also covers things like inpatient care. And that could be either for mental health reasons or for chemical health reasons, but those are things that are also covered under the statute.
Awesome. And the last one here, if you choose a private plan, could you change to the state plan in later years?
Yes, definitely. So there is an option and there is sort of stipulations of how to terminate a plan. There'll be a renewal process for plans at the end of the year. So if someone does not want to renew, they'll be able to let us know and then end the program and join back as part of the state plan.
Wonderful. All right, folks, it is almost 12:55, so we will conclude our live Q&A.
Questions.
I know, so many good questions. And Betsy, thanks so much for all your insight. And we want to be respectful of everyone's time here today. So we'd like to wrap up by asking for your feedback on today's webinar. The QR code goes to a short survey, and we'll put that link in the chat as well under the Feature tab. The feedback survey only takes 1 to 2 minutes and will help us understand what worked well and what could be improved in the future. And as mentioned, if we did not get to your questions today, please visit our website where you can check out our FAQ pages for both employers and employees. There's a lot of helpful information there. And as always, our contact center is here and ready to help you with any and all questions. Just fill out that form on our website and our contact center will get back to you within a couple of days. And as a final reminder, the slides from today's webinar are on our website as well. And again, that's info.paidleave.mn.gov. All right, well, our time is coming to a close, so we will end it there. Thanks to everyone who joined us and have a great rest of your day. Bye now.